Good morning. My name is Caroline Danielson, and I am a Senior Fellow and Policy Director at the Public Policy Institute of California. Welcome to our virtual program today, featuring the findings from our recent report, The Impact of Health Insurance on Poverty in California. For today's program, my colleague, Patricia Malagon, will present the main findings from the report. Then she and I will discuss some of our main takeaways and answer questions from the audience. Before we begin our program, I would like to acknowledge Sunlight Giving, which supported today's program and the research that underlies the report. And 3 housekeeping items. First, the report and slides from today's briefing can be found on our website at ppic.org. Also, as a public charity, PPIC does not take or support positions on any ballot measure or legislation, nor does it support, endorse, or oppose any political parties or candidates for public office. Finally, please email your questions for us today to the address on the screen, ppiceventquestions@gmail.com. Please include your name and organization along with your question. And now I would like to welcome my colleague and fellow report author, Patricia Malagon.
Thank you, Caroline. I will start sharing my screen with you. Good morning, everyone. Today, I will share findings from our recent report on the impact of health insurance on poverty in California. I would like to acknowledge my co-authors, Caroline Danielson and Shannon McConville, and acknowledge Sunlight Giving for funding our work. I will begin with some recent and upcoming policy changes to set the context of the report. Over the past decade, there have been numerous public investments in healthcare coverage. The Affordable Care Act increased healthcare coverage for many low-income Californians through Medi-Cal. The state's implementation of the federal Medicaid program. Under the Affordable Care Act, anyone can purchase healthcare coverage, and it does not depend on the individual's health condition. While other Californians have gained health insurance through subsidies purchased through the state's insurance marketplace, Covered California. Yet, we have not been able to study the impact of these coverage expansions on economic well-being and poverty. This timeline shows Medi-Cal expansion starting in January 2014 to January 2024 to all income-eligible residents, regardless of immigration status, and Covered California subsidy expansions during the pandemic in March 2021. These Medi-Cal expansions have cut the population of uninsured Californians by half, expanding coverage to undocumented individuals who were excluded from the federal Medicaid program. Next, I will discuss the framework of our report. This report captures the contribution of health insurance coverage to financial well-being by adapting the California Poverty Measure framework. As for background, the California Poverty Measure was developed jointly by PPIC and the Stanford Center on Poverty and Inequality over the past decade, and offers a framework for assessing poverty across the state. It improves on official poverty metrics by taking into account variation in the cost of living, other necessary expenses, including childcare and work-related expenses, as well as the impact of social safety net programs such as CalFresh, CalWorks, and tax credits, both federal and state. We developed the Health Inclusive Poverty Measure to include the need for health insurance and to count healthcare benefits as resources to meet that need. The state expanded public health insurance benefits over the past decade, and the Health Inclusive Poverty Measure provides a way to track the contribution of these benefits on family needs and resources. Considering health insurance in our poverty metric is important since many Californians rely on public health insurance programs to meet their healthcare needs. Medi-Cal is the largest program by far. Based on 2021 estimates, Medi-Cal enrollees totaled 13.5 million, followed by Medicare at 6.5 million and Covered California at 1.6 million. This report compares the impact of different health insurance programs, both public and private, and focuses on people younger than age 65, as coverage and costs for those over age 65 is tied to the federal Medicare policy. When we include the need of healthcare in the poverty threshold and health insurance benefits to resources, both resources in the poverty threshold increase. Importantly, we only raise resources for those with health insurance benefits. For example, a Californian who lacks healthcare coverage does not receive healthcare benefits, but still has a healthcare need to meet. Therefore, a household is poor if its resources fall below the health inclusive poverty threshold. The amount required to meet the basic needs is about $35,900 on average, which is the dark blue portion on the graph. And the health insurance need raises a poverty threshold by $17,400, the orange component of the graph. Therefore, the health inclusive poverty threshold totals $53,300. The non-health needs component includes varying housing costs, clothing, and utilities. As we can see, LA and Santa Clara County have higher housing costs than Fresno County in the Central Valley region. The health inclusive poverty measure factors in the varying costs of housing and captures geographic differences in the cost of health insurance. Health costs are lower in the southern region and higher in the Bay Area and Central Valley regions of the state, which reflect the premium cost for health insurance plans available from Covered California. Public health coverage through Medi-Cal and Covered California public subsidy structures support many low and middle income Californians from these high health costs and meet their health care needs. Now I will turn to our main report findings. Here we compare poverty rates across different health insurance programs. The overall health inclusive poverty rate is 11.5%. Among uninsured Californians, 4 in 10 are living in poverty. That's a poverty rate of 38.4% compared to 18.5% of those covered by Medi-Cal to 15.6% among those covered with insurance through Covered California and only 4.2% of those with employer-based coverage. We would expect poverty to be higher among those with Medi-Cal since the program is designed for low-income Californians. Yet there are other factors such as access to safety net benefits, employment opportunities or barriers, and varying housing costs that play a role in reducing or increasing poverty. Even then, the poverty rate among those with Medi-Cal coverage is still well below the uninsured poverty rate. We also show the impact of healthcare coverage on poverty by other demographic groups and breakdowns in the report. In addition, we included undocumented immigrants in our analysis, and here we can see poverty rates are highest among those more likely to lack healthcare coverage, in particular non-citizens, at 27% versus citizens at 9.1%. Those who fall under the non-citizen category may be income eligible for public health insurance through Medi-Cal, but do not qualify due to their immigration status. Recalling the large state and federal expansions to Medi-Cal over the past decade, all of which have contributed immensely to family resources, when we remove Medi-Cal healthcare benefits from family resources, the overall poverty rate increases from 11 to 17.2%. That is about 2.1 million Californians. Poverty among young children more than doubles, increasing from 7 to 16.7%. I want to note this is an upper bound since individuals are likely to receive coverage from other health insurance programs. So we assume that those on Medi-Cal will become uninsured in this scenario. Importantly, Covered California may have a smaller scope. If we remember, about 1.6 million enrollees participated in 2021 compared to the 13.5 million enrollees in Medi-Cal. Nevertheless, it still reduces poverty through premium subsidies at lower costs for low and middle income families. These subsidies help reduce poverty by about 1 percentage point overall, equivalent to about 345,000 Californians who would fall below the poverty line if we remove Covered California subsidies from family resources, with the larger impact on older middle-aged adults ages 45 to 64. This is similar to the impact of the federal earned income tax credit, which lowered poverty by 1.1 points in fall 2021. And both these poverty changes without Covered California subsidies and Medi-Cal highlight the success of public investments in healthcare which have expanded coverage and reduced the uninsured population to a historic low in the state. By including health insurance in the California Poverty Framework, our estimates show the direct impact of health care coverage on poverty in the state. With many pandemic-era policy changes expiring or have expired, it is important to provide a complete study of all the social and health policies that affect Californians, specifically those who are low and middle income, uninsured, and ineligible for safety net and healthcare benefits, including Medi-Cal expansions, covered California subsidy expansions that we saw during the pandemic to middle income families, and the upcoming resumption of Medi-Cal eligibility determinations in the next coming months. Thank you. This is the end of our presentation portion. And as a reminder, you can submit your questions to PPIC eventquestions@gmail.com. And please include your name and organization along with your question. Now I will stop sharing my screen and invite Caroline back for the Q&A.
Thank you, Patty. At this time, we'd like to go ahead and answer your questions. One question that we can perhaps start with is, how are families affected by individual family members being uninsured? You mentioned that poverty rates among the uninsured are far higher than those for all other Californians, even for those with Medi-Cal who have relatively low cash incomes. But how does this affect family members who may themselves have insurance? So one thing that we can see when we take a look in our report at the data is that many families with uninsured members also have insured members. There's many with mixed insurance status. So for example, we find about 2/3 of those who are uninsured have someone with Medi-Cal. And so public health insurance and any source of health insurance can help families who have some members who are uninsured. And we also know, looking at the Medi-Cal expansions to undocumented immigrants, which will complete in 2024, that there are many more mixed status families than there are undocumented immigrants in California, so that we expect up to about 1 million people who are not undocumented to be affected indirectly by the expansion of Medi-Cal to the remaining adults that will occur in January 2024. Turning to another question, how did you determine, you mentioned you showed us a slide showing with health insurance need and non-need and how it varies across the state and that it's a substantial portion of a basic family budget. How did we determine health insurance need in the research?
Yeah, thank you, Caroline. So the benchmark of an adequate level of health insurance is the total cost of the silver plans purchased on Covered California. So we use the cost of the silver plan to assign a value for health insurance to everyone, regardless of their health insurance coverage, since these plans are comprehensive and include essential care services. As I mentioned earlier, under the Affordable Care Act, anyone can receive coverage regardless of their health condition. And there are other provisions in the Affordable Care Act that make sure that the silver plan is available and affordable to everyone. That's how we assigned or determined the health insurance need and the thresholds and resources.
Right. So it's it's a basic sort of what's determined to be socially necessary to have an adequate level of coverage.
Yeah, and just as a reminder, we assign those only to people who receive health insurance in their resources.
That's correct. So everybody has a need, but if you're uninsured, you don't have the resources to meet that need. But in California, with our adoption of an expansion of Medi-Cal and launch of the Covered California marketplace, we've made a concerted effort to cover as many Californians as we can so that we can cut our uninsurance rate and meet that basic need.
Yeah. I think we have another question coming in. They are asking, why is it important to consider health insurance in a poverty metric?
Yeah, that's a good question. So if we go back to the official poverty metric that was launched back in the 1960s, and it was an innovation in its time, it doesn't take into account what it's based on is a basic food budget. And it's been updated for inflation since, and of course it varies by family size, but it doesn't vary by where you live or by other basic needs that people have. So an innovation of the California poverty measure, which follows the national census effort to update with a supplemental poverty measure, our CPM measure takes into account not only food, but shelter needs and also utilities. The CPM that we've been producing for a decade, though, does not explicitly take into account the need for health insurance. It deducts health insurance expenses that you might have out of pocket, but it doesn't recognize health insurance as a basic need. But with the changes in health policy and California's effort to ensure as many people as possible and to reach universal coverage, health insurance has become a basic need. And for that reason, we thought it important to include in a poverty metric.
Yeah, and also like yesterday, the National Academy of Sciences released a report that also proposed including the basic health insurance benefits in the poverty metric.
Yes, that's correct. And so that's not incorporated into the census measure at this point in time, but as you say, it's anticipated that will become part of the supplemental poverty measure, because the end goal is to accurately reflect a basic needs budget and how many families are reaching that budget and how many families fall short. We have another question from David Kane at Western Centered on Law and Poverty. Undocumented children, young adults, and older adults can access Medi-Cal. And starting in January 2024, even people aged 26 to 49 will get full scope Medi-Cal. How might this impact the poverty rates? Yeah, so we took a look at this in our report. And again, looking at both, we took a look at it both from the perspective of individuals who may gain coverage and from the perspective of mixed status families. So families where some may be already eligible for insurance and some may gain insurance in January 24. And what we found was that among non-citizens, which that group includes both documented and undocumented residents, that poverty could drop by up to 2.5 percentage points with the addition of the 26 to 49-year-olds to eligibility for Medi-Cal. By nearly 3 percentage points. But looking at mixed status families, their poverty could drop by 2.5 percentage points. And again, because family budgets are family budgets. So if you're living in a family where some are covered and some are not, you may yourself experience poverty because of you don't have adequate resources to meet the family's health insurance need. And so this affects both undocumented immigrants and a broader group of Californians who may themselves be eligible for insurance, but and actually have insurance, but live in a family where not all members are eligible.
Yeah.
Here's another question. How do health investments compare with social safety net investments in terms of poverty impacts? Do you want to take that one, Patty?
Yeah. So safety net programs like CalFresh and CalWorks or tax credits have different purposes and provide support for different groups or subgroups of Californians, and health insurance is different. Medi-Cal coverage has a big impact on poverty, as we saw and Caroline talked about briefly. So when we zero out Medi-Cal, overall poverty increases from 11.5 to 18.9%. And this is more than twice the increase in poverty absence of CalFresh food assistance, the largest poverty mitigating safety net program. And as you recall, Covered California had a smaller scope in 2021. It only reached 1.6 million participants. And without Covered California subsidies, poverty rose by 1 percentage point overall. This is similar to the impact of the federal earned income tax credit, which lowered poverty rate by around 1.1 points. However, there are about 3 million tax filers in California who are eligible to claim this tax credit, and the payment structures of Covered California subsidies and earned income tax credits are very different.
And in part, this is just an acknowledgement that health coverage is expensive, and the investment that it's needed is substantial and has a big impact on poverty as a result.
Yeah.
And here's another question. How could the restart of Medi-Cal eligibility determinations, which are slated to start in a few days, how could this impact poverty? Yeah, so we take a look at this in the report. We don't take a look at this directly in the report. As Patty mentioned in her presentation, we do look at a scenario where we zero out Medi-Cal from everyone's resources and see very large poverty impacts, with children seeing poverty rates that are nearly are more than double what they're actually seen in the actual world we're in. That's of course not the world that we're entering with redeterminations, but what policy makers do need to keep an eye on is what could happen if folks slip through the cracks. So if we often see across both health and safety net programs the issue of churning, where someone may lose eligibility because they haven't filed required paperwork and haven't kept their status current. With the pandemic, we paused redeterminations, so that kind of churning didn't happen, and now the redetermination needs to happen. So some folks will have become ineligible, and they will have already gained other sources of insurance, but there is the potential for some people to not redetermine their eligibility for Medi-Cal, even though they are eligible, and to slip into uninsurance. And this is something that that policymakers need to keep an eye on and track as we're rolling this out over the next 18 months. I think a final question is, was there anything that surprised you from the findings? Well, I can start here. I think that one thing that we expected, but it was perhaps interesting to see, is how much Medi-Cal really does alter poverty once you take it into account in a framework that includes a health need. That Medi-Cal has such a powerful effect on family financial well-being.
Yeah, and I think for me, what I found surprising was that poverty rates when we include health insurance are extremely high for non-citizens in California. And it's the Medi-Cal expansions have expanded coverage to all income eligible residents, and the last wave is coming up in January 2024. So I think that's really important. And programs like My Health LA have supported, a subgroup of these residents in the state to access healthcare coverage. So I think it's really important to acknowledge.
Thank you, Patty. So we have reached the end of our program today, and I would like to thank you, Patty, for your presentation. I would also like to thank our funder. And finally, thanks to all of you for joining us online today. If you pre-registered for this event, later today you will receive a survey. We would appreciate you taking a couple of minutes to respond to let us know how we did. Finally, please be safe and have a good afternoon.